We'll set up for some supine bridging with inversion of the legs. The inversion happens from the top of the hip sockets. The legs are hip distance apart. The knees will come together. We're going to keep them together. The bones of the big toes are heavy. Pressing into our arm extensors, our triceps, hands, wrists. We pick that pelvis up into the air, holding at the top for 1 breath. Inhale 1, breathe. Exhale 1. Inhale. From the sternum, we puddle the heart down, imprinting each vertebra into the mat. Tailbone reaches away from the body towards the toes. At the end, pause, inhale, pull the abdominal wall in, lift in and up on the muscles that stop your stream of pee as you press up. Press through the bones of your big toes, keeping that neutral pelvis lifted. Inhale 1, breathe. Exhale 1. Inhale, peeling down from the upper back, mid back to tailbone. Pausing at the bottom, inhale, breathing laterally. Pressing heavy into the bones of your big toes. Pick the pelvis up. Hold it up. Inhale 1, breathe. Exhale 1. Inhale, sternum reaching towards the back ribs. Body imprinting into the floor as it comes down. Tailbone reaching towards the toes at the bottom. Inhale. Bones of the big toes heavy. Sternum reaches towards the back ribs. Pick those hips up. Neutral pelvis at the top. Inhale 1, breathe. Exhale 1. Inhale, peeling down vertebra by vertebra. Imagine ice cream on the chest, puddle the heart inward. Tailbone's last, tailbone reaches towards the feet. Bones of the big toes heavy. Knees should be staying together. Triceps should be engaged. Wrists, palms pressing heavy into the floor. Pick that neutral pelvis up, hold it up. Inhale 1, breathe. Exhale 1. Inhale. Brace those abs, peeling down upper back, mid back to tailbone, reaching the tailbone towards the feet. We'll set up, grabbing our heaviest Theraband to put around our feet for a side lying double leg lift. You'll put both feet into the band, and the arm will rest by the side of the body, that top arm. You can either place the ball under your head for side lying, or you can rest your head on your bicep. We're going to breathe in, brace the abs, lift both legs up. Inhale at the top, brace the abs, and lower both legs down. Breathe in, brace, exhale, lift. Inhale at the top, brace, and exhale, lower. One more at that tempo. Inhale at the bottom, pull the abs in towards the spine, sternum reaches towards the back ribs, lift up, and inhale, lower immediately down. So now we brace, lift, exhale, inhale, lower, brace, lift, exhale, inhale, lower, lengthening the body, using the abdominals to initiate the lift and lower, keeping the ribs closed, the tailbone reaching behind you for some lumbar extension. On your next one, I want you to hold it up, and with your legs parallel, I'd like you to invert the legs from the top of the hip socket. So you're moving the legs from the hip sockets, inversion, and then back to parallel. Inversion to parallel. The breath is exhale to invert, inhale, parallel. Exhale, invert. Inhale, parallel. Exhale, invert. Inhale, parallel. You're doing great. Keep going. Exhale. And inhale. Stay long. Sternum reaching towards the back ribs. Abs pulling in and up. Tailbone reaching behind you. Chin retracted so the back of the neck is long. Brace the abs. Inversion. Inhale, parallel. Brace the abs, inversion, and parallel. One more. And lower the legs. Let's set up on the other side. We'll begin with our double leg lower and lifts. Take your time setting up. Ball under the head or head resting on your bicep. Feet are active. Flexing those feet will help keep the band captured. The top arm is resting along the side of the body. We have the assistance of this heavy Theraband around the feet. As we lift up, we brace the abs. Inhale at the top, brace the abs, and exhale, lower down slowly, keeping this nice tempo to begin. Inhale, belly button to spine. Lift up on the muscles that stop your stream of pee. Sustaining that lift, hold at the top. Inhale, breathing into the rib cage. Pull the abdomen in. Lift in and up on those muscles. Hold them tight. As you exhale and lower down. Inhale, pull the abs in. Brace as if you're going to be punched in the gut. Lift all the way up. Inhale, lower. Moving at a quicker tempo. Brace to lift. Inhale, lower. Brace, lift. Inhale, lower. Keep that going. Some checkpoints. The feet nice and flexed. The legs parallel. The tailbone reaching behind you for lumbar extension. The belly button pulling in towards the spine. The sternum reaching in towards the spine. Collarbone wide, shoulders plugged down the back. Next one, hold it up. Moving into inversion from the top of the hip sockets. Back to parallel. Brace the abs. Exhale, inversion. Inhale, parallel. Brace for inversion. And inhale, parallel. Keep that going. Check in with your checkpoints. Feet dorsiflexed. Try to not lock the knees into hyperextension. Keep a subtle bend in the knees. Keep your shoulders plugged down your back. Retract your chin. Make sure that you're not gripping in your neck. Collarbone wide. Sternum reaching towards the back ribs. Find that breath. It's either a lift, a sustained lift of the pelvic floor muscles, the muscles that stop your stream of pee, or you're imagining someone punching you in the gut and you're bracing and it's a ha sound. Either way, you'll contract the TVA to condition the deepest layer of your core. Finish up your last one and we'll release that. We're going to elevate our pelvis, still holding on to that heavy Theraband with one hand, elevating the pelvis with the anti-burst ball for some inversion footwork while we stretch our IT band. So crossing the leg, one leg across the body, the other foot can be down for stability, one hand down for stability. Arch of the foot around the band and we'll take the foot in towards the face and back to parallel. In towards the face and back to parallel. Reach the tailbone away from you as you're working here to accentuate that lumbar extension, your sternum reaching towards the back ribs and moving into that nice inverted position of the foot, back to parallel and inversion, parallel, bracing the abs as you invert and parallel. This is really good to combat the supination we see with sway back posture due to the bow-leggedness and overactivity of the lateral hamstrings, the glute med, the calves, especially the peroneals and the IT band. Couple more breaths here, trying to squeeze the quadricep to lift the kneecap, maximizing the stretch in the IT band, dorsiflexing the foot evenly. Go ahead and switch sides, setting up on the other side, having one arm down so you don't roll off the anti-burst ball, making sure that ball's high enough that you can arch your low back, reaching the tailbone away from you towards that foot that's down. The foot that's down, the bone of the big toe's heavy. You've wrapped that heavy Theraband around the arch of the foot, inverted the leg from the top of the hip socket and moved it across the body to get into the IT band and lateral hamstring. As we work the foot, bringing it into inversion, back to parallel. Brace the abs, inversion and parallel. Keep going at that tempo. Be cognizant of your breath. Sternum reaching towards the back ribs. Chin retracted. Collarbone wide. Inhale. Brace those abs and exhale. Think about the quadricep, the front of the thigh, lifting that kneecap up, maximizing the stretch in the calf and the hamstring. isolating the footwork from the ankle joint, not from the knee or the hip flexor. Finish up your last one. And set the band to the side, placing that foot down. Pick the pelvis up and slide the ball out. Lower the pelvis down. Great job.